Good evening and thank you for joining us. We are going to begin with breaking news on what could be a breakthrough in the fight against coronavirus. Doctors in England say they've discovered the first drug that dramatically reduces deaths in COVID-19 patients. And it turns out it's already on the market. The drug is a low-cost steroid called dexamethasone. And researchers say in a large trial, it cut deaths among the sickest coronavirus patients by a third. Tonight, doctors are cautiously optimistic that if the research pans out, the drug could eventually help save hundreds of thousands of lives. The new study comes as nearly half of the states in the U.S. are struggling with spikes in cases, including in Florida, where tonight the state has its highest number of new infections since the pandemic began. Oklahoma, Texas, and Arizona are also reporting record highs in new cases today. And as we come on the air tonight, more than 116,000 people have been killed by the virus in the U.S., and there are more than 2.2 million confirmed cases nationwide. Tonight, there's also new research that says wearing masks could prevent hundreds of thousands of infections by stopping the spread of virus droplets in the air. So there's a lot of news to get to tonight, and our team of correspondents is standing by. CBS's Manuel Bojorquez is going to lead off our coverage tonight from Miami. Good evening, Manny.
Good evening, Nora. Florida has set yet another daily record. More than 2,700 new coronavirus cases were reported today. Hospitalizations are also up in several states, so word of a medical advancement could not come soon enough. It's being called a medical breakthrough in the fight against the coronavirus. The world's largest trial of existing treatments found a cheap, decades-old anti-inflammatory steroid called dexamethasone reduced deaths by 20% in COVID-19 patients on oxygen.
What we saw was really quite remarkable. In ventilated patients with COVID-19, the drug dexamethasone, so 10 days of treatment with that, which is a tablet or an injection, reduces the risk of death by about 35%.
Dr. Scott Krakauer was not part of the trial, but received dexamethasone in April when he battled the virus himself in New York City.
So is this a game changer?
I think it is a game changer. I mean, it was the first time in I felt like almost a month. I stopped coughing for an hour. It's such a, I don't know, for me, a mind-blowing moment.
CBS News Chief Medical Correspondent Dr. John LaPook.
The fact that they're saying there was a statistically significant decrease in mortality with dexamethasone is very encouraging.
News about the treatment comes as one of the prediction models used by the White House now projects 200,000 COVID-related deaths in the U.S. by October. 19 states are reporting increases in average daily new cases compared to 2 weeks ago. Today, Texas saw a record jump of more than 2,600. Florida has reported nearly 15,000 new cases over the last 10 days. But today, in a Wall Street Journal op-ed, Vice President Mike Pence called reports of a possible second wave overblown. Despite record new cases, Florida Governor Ron DeSantis says he will not close the state.
To suppress a lot of working-age people at this point, I don't think would likely be very effective.
Still, Miami's mayor put the next phase of reopening on hold due to recent spikes. Austin's mayor extended a stay-at-home order, and Nevada's governor said the state was not ready to enter Phase 3. There was encouraging news today about the economy. Retail sales jumped nearly 18% last month, a record, as more businesses and restaurants reopened. The question is whether that comes at the expense of social distancing. Nora?
Manny Bojorquez, thank you.